So good afternoon and welcome everyone to today's 60-minute webinar session. I'm going to be talking about preventing Clostridioides difficile infections, a refresher session. I also wanted to mention that November is C. diff Awareness Month. Our Project Firstline assistant, Abby, will be sharing information and educational tools with you throughout the webinar that you can use to raise awareness in your facilities. I'd also like to mention U.S. Antibiotic Awareness Week is observed each year from November 18th to the 24th. The purpose of this observance is also to raise awareness of the importance of appropriate antibiotic and antifungal use and the threat of antimicrobial resistance poses to people, animals, plants, and their shared environments. And Abby has a link to some more information regarding that as well. So today's session is brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health in partnership with the CDC. Thanks everyone for coming today, and I want to thank you all for the vital role you play in healthcare. If you haven't done so, please take our pre-session survey, and that survey will close shortly into the webinar, and that is required for continuing education. And at this time, I'd like to ask Dr. Alexis Kearney to hop on camera and introduce herself. She'll be here throughout the webinar and available for questions and answers after.
Hello, everyone. Welcome. We're excited to have you here. We'll be monitoring the chat and Q&A box as we go along, so please let us know if you have any questions.
Thanks so much, Dr. Kearney. My name is Stephanie Doyle. I'll be your host and presenter for today. I'm an infection prevention training liaison for Project Firstline Rhode Island and a community public health nurse at the Center for Acute Infectious Disease Epidemiology at the Department of Health. I've been practicing healthcare for over 20 years in many different roles and have an array of different nursing experience, which has led me to my practice in public health and education. I hope to raise awareness for you today and help you understand the importance of infection control and prevention to help keep our patients, ourselves, and our colleagues safe. So I'll just take a moment here to go over our continuing education criteria for those of you who are attending to receive continuing nursing education credit and other continuing education credits. This is a 60-minute session, and it's approved as a nursing continuing professional development activity by the Northeast Multi-State Division Education Unit and an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. And in order to receive your CNE credit, you will need to participate in the pre-session survey, attend this live training. You will be emailed a post-session survey and also a post-session quiz, which must be completed as well. And for our other colleagues here today, the quiz is optional, but you must complete items 1 through 3, pre-session survey, live training, and the post-session survey. And we are happy to answer any questions you might have regarding our continuing education credits. So before we begin, I'd like to direct your attention to the chat and introduce Abby Anderson. She's our Project Firstline Rhode Island project assistant. And I have the whole team here with me behind the scenes in support of this webinar. Abby will be posting information and educational tools and resources throughout the webinar via chat. If you'd like to take a minute and introduce yourselves in the chat, tell us your name. You can provide your email and let us know what organization you're coming in from. So glad to meet everyone, and if you're joining us again, happy to see you again. During the session, everyone will be muted. If you'd like to be unmuted, you can raise your hand during the Q&A session. You can post questions in the chat or the Q&A box. We will try to address them at the end of the session. If we're not able to get to those, we will certainly email you the answers to the questions that you have. All right, so let's get started. So this is our agenda for today. We've done our welcome and our introductions. We'll review our learning objectives, and we're going to focus on talking about Clostridioides difficile, or C. diff. I'll be referring to it throughout the webinar as C. diff. We will define C. diff and review some data, talk about the healthcare implications of C. diff, and we'll go into detail about the infection prevention and control for C. diff infections, which is abbreviated as CDI, which you'll hear me use throughout the webinar as well. We'll have some time to reflect, go over some key takeaways, some announcements at the end, and we'll ask for some feedback from you. And we'll do a Q&A at the end if time allows. So at the end of today's session, you'll be able to define Clostridioides difficile infection and other key terms, and identify who is at risk for infection, describe ways you can prevent illness by recognizing risks and identifying where germs live, identify pathways that C. diff infection can spread, learn infection control actions proven to prevent the spread of CDI, apply knowledge to drive infection prevention in your workplace, and empower others to strive for high standards of care when dealing with infection prevention and control in the healthcare setting. So the CDC has designated Clostridioides difficile as an urgent global threat, calling it an immediate public health threat that requires urgent and aggressive action. C. diff is considered an epidemiologically important pathogen, which means it is an infectious agent that has one or more of the following characteristics: are readily transmissible, have a tendency towards causing outbreaks, may be associated with severe outcomes, or are difficult to treat. So in response to this urgent threat, the Antimicrobial Stewardship and Environmental Cleaning Task Force, or abbreviated as AMSEC, of Rhode Island, has developed a C. diff playbook, which outlines an action plan to mitigate C. diff in our community. The following you see there on the slide are the guiding principles they have outlined to guide efforts within the healthcare system as a whole in Rhode Island to help reduce the incidence of CDI. You can review here, and also Abby will be sharing a link in the chat to the C. diff playbook for your review in more detail. And I just wanted to also share some key terms that you'll be seeing throughout the webinar. The definitions are here for your reference later as we go through the material, and you'll hear them further explained as we go as well. So I just wanted to review some data and facts with you here. Before we narrow down to C. diff specifically, I wanted to mention healthcare-associated infections resulting from complications of health. Before we narrow down to C. diff specifically, I wanted to mention healthcare-associated infections, or abbreviated as HAIs, because C. diff is often associated with healthcare-associated infections. So they are resulting from complications of healthcare. They are linked to high morbidity and mortality. On any given day, 1 in 31 hospital patients has an HAI. Additional infections occur in healthcare settings. Many HAIs are caused by the most serious antibiotic-resistant bacteria and can lead to sepsis and sometimes death. And HAIs can happen in any healthcare facility, including hospitals, ambulatory care centers, end-stage renal disease facilities, and long-term care facilities. Bacteria, fungi, viruses, or other less common pathogens can cause HAIs. And the U.S. Department of Health and Human Services has identified the reduction of HAIs as an agency priority goal. HHS is committed to reducing the national rate of HAIs. And now we'll talk specifically about our HAI of concern today, C. diff, and learn a bit more about the bacteria itself. So what is Clostridioides difficile? The technical definition is a spore-forming germ or bacterium that causes severe watery diarrhea, and colitis, an inflammation of the colon, and is formerly known as Clostridium difficile and often called C. diff or C. difficile. It is a gram-positive rod, which is spore-forming. Most common cause of antibiotic-associated diarrhea illness. It causes symptoms which may be life-threatening and can colonize in the gut. And as I mentioned, a pathogen of epidemiological importance and is often a healthcare associated infection, but can also be community acquired. So just a little bit more about spores. So as I mentioned, C. diff is spore forming. It is gram-positive anaerobic bacillus that can produce toxins, commonly found toxin A and toxin B. These toxins act on the lining of the colon to create a complex bodily response, including fluid secretion, inflammation, and tissue damage, which fit the clinical picture and are key features of C. diff infection. So a little more about spores. When C. diff germs are outside the body, they become spores. Contamination and survival of C. diff spores on hospital surfaces have been reported and shown to be associated with spread through indirect transmission, which means the transfer of a germ from a reservoir where the germ lives to a person by objects or environmental surfaces. Excuse me. These spores are an inactive form of the germ and have a protective coating, allowing them to live for months on surfaces. The germs become active again when the spores are swallowed and reach the gut. It's time for our first poll question here. How long have C. diff spores been proven to live on surfaces? So we have A, 24 hours, B, 5 to 7 days, C, up to 5 months, or D, 1 year. So give you about 1 minute to select your answer here. All right. Let's see how we did. Very good. So we have 53% saying up to 5 months, which is correct. So according to the journal, excuse me, of Microbiology article titled Detecting Clostridium difficile Spores from Inanimate Surfaces of the Hospital Environment, Which Method is Best? C. difficile spores can be shed to the environment by both asymptomatic and symptomatic patients and may survive for up to 5 months on inanimate surfaces. They resist the bactericidal effects of most hospital disinfectants and most other decontamination techniques. Very good. Thank you for that. And C. diff is considered by the CDC an urgent public health threat. While healthcare-associated C. diff cases have decreased somewhat, community-associated cases have not. So why do we care so much about this infection? Why do we care about C. diff as an HAI? So it is a major cause of death and increased morbidity in hospitalized patients worldwide. C. diff infections are more common and tend to be more severe in older patients who may have other serious health conditions. Healthcare settings can act as amplifiers of infection. Healthcare spread has often been an important contributor to the extension of outbreaks, which pose a significant economic burden, as you can see there. Now let's review some myths versus facts. So our first myth, alcohol-based hand sanitizer, or ABHS, and soap kill C. diff spores. So that is a myth, and in fact, C. diff spores may not be fully removed from hands, regardless of the method used to clean hands. Current evidence demonstrates that C. diff spores may not be fully removed from hands regardless of the method used to clean hands. This further emphasizes the need for appropriate use of gloves for the care of the patient with CDI. Alcohol-based hand sanitizers are highly effective against non-spore-forming organisms, but they do not kill C. diff spores. And our next myth versus fact, CDI only occurs in hospitals. when in fact, approximately 45% of cases are community acquired. That is why it's so important to educate our patients who have been diagnosed with C. diff, and be advocates for antimicrobial stewardship, which we'll talk a little bit more later on in the webinar. So finally, our last myth versus fact: CDI is unavoidable in healthcare, when in fact, many cases of CDI can be prevented with evidence-based recommended infection control and prevention, or ICP, strategies. Some cases of CDI may not be preventable, but we can certainly greatly reduce. As we mentioned, CDI is the leading cause of antibiotic-associated diarrhea and one of the most common healthcare-associated infections in the United States. The Emerging Infections Program for Healthcare-Associated Infections has a broad surveillance area where selected territories report cases based on case definition criteria. Much of the recent increase in the incidence of mortality of CDI is attributed to the emergence and spread of hypervirulent resistant strains of C. diff that produce greater quantities of principal virulence toxins A and B and have additional factors enhancing its virulence. There's just some uh, data there for you to review. So the first step in stopping the spread of infection is identifying infection risk. When you are aware of who is at risk and how germs spread in healthcare, you can use your clinical knowledge and skills to impact decision making. Knowing how to recognize risk and take infection control actions, such as implementing transmission-based precautions, is key in preventing the spread of infection. If prevention actions fail and the patient, who may be highly susceptible to infection, becomes ill, there are proven actions we can take to help keep ourselves, our patients, and our families safe. Once illness is suspected, infection control actions such as knowing when to test and isolate can help mitigate the spread of illness. Written protocols can be helpful by outlining a process that has been proven effective in managing patients with suspected illness. Making these protocols transparent and accessible to all members of the care team and providing ample time for education and training can establish an environment within the facility that focuses on infection control and prevention. Education that is clear and understood by everyone is vital to implementing actions that can reduce the spread of illness. Patients with prior or recent infection of CDI are likely to become ill again with the infection. Key actions to lower the incidence of CDI are follow-up and communication. Actions go beyond what is done on the front lines. A holistic approach to care involving all personnel involved in caring for the infected patient, including administration, social workers, environmental services, pharmacists, can be an effective tool for reducing outbreaks and spread of infection. These are key strategies that can be helpful in identifying and managing patients with CDI. Now we'll talk about who is at greatest risk for CDI and how they may present clinically in practice. So which patients are at increased risk for CDI? So patients who are most vulnerable to CDI are those who have had a recent antibiotic exposure, those with an immune compromising condition such as cancer, or use of a medication that impairs their immune system, such as long-term use of steroids or chemotherapy. Prior C. diff infection can increase the risk of recurrent infection, also increasing the risk of CDI, a recent or long stay in a healthcare facility, recent gastrointestinal surgery, serious underlying illness or advancing age, or a combination of any of these risk factors. Even though advancing age is a risk factor, CDI affects patients across the lifespan. So what do we look for clinically in a patient that may have C. diff infection? So clinical manifestation of the infection caused by C. diff vary from asymptomatic to severe illness, depending on a wide range of factors. The patient may present with complaints of abdominal pain, watery diarrhea with mucus or blood, anorexia, nausea, vomiting, or low-grade fever. The provider may assess abdominal tenderness and abdominal distension. Diagnostic studies may show inflammation of the colon or colitis. If symptoms are severe and left untreated, the patient may develop a toxic megacolon, leading to peritonitis, bowel perforation, or even death. CDI range from asymptomatic infection to severe infection, which can be complicated by sepsis, which may require surgery and could also lead to death. It is so important to recognize risk factors and test accordingly so treatment is not delayed. A few key notes to think about when attempting to recognize C. diff versus other causes of watery stool. Identify if the patient has any risk factors that we talked about in the previous slide. Submit specimens based on current recommendations, which we'll review in more detail in a few moments, and identification of symptoms. And here we have some clinical tools that you can use to share with your teams to raise awareness of C. diff infection. Abby will be posting the link to those tools in the chat, and you can use those in your clinical areas as well. And here is one more tool, C. diff fact sheet. Abby will be posting the link as well. It's an infographic for healthcare professionals. It has some great information on prevention measures, who is at risk, how it spreads, and how to prevent C. diff. Some good tools there from the CDC. So now we're going to get into how C. diff spreads and makes people sick. Time for our second poll question here. So prevention is key in reducing and eliminating CDI. So our next question is, what can we do as healthcare personnel to prevent the spread of CDI? A, be aware of what antibiotics your patient is prescribed. B, know when to test for CDI. C, isolate patients as soon as possible. D, use proper PPE and perform hand hygiene before and after glove use. Or E, all of the above. So give you 30 seconds this time to answer that question. All right, let's see how we did there. Perfect. 100%, all of the above. Very good. Now we're going to get into some detail about infection prevention and control. Thanks for participating there. Very good. 100%. So here we're going to discuss and review 5 elements of how germs spread and cause infection. So there are more pieces to the puzzle of germ spread than reservoirs and pathways. Germs need to arrive at a new person. That person could be a patient or you or one of your colleagues. And in order to infect them, the germ needs to get around the person's natural defenses. If the person is already sick, then their immune system could be weak and not able to fight germs as well as a healthy person's can. Throughout all of these elements, the germ needs to survive and stay viable in the environment if they're going to make someone sick. The infection control actions that you take at any one of these points help keep germs from spreading and causing infection. Let's review this in a little more detail relative to C. diff infection. So germs need a pathway to be spread out of the reservoir where they live. Let's think about some reservoirs where C. diff could live. As you think about where the germ lives, also think about how the germ travels or what pathways it can get into the body. Go ahead and share your answers in the chat. So we know C. diff lives in the gut. So what are some reservoirs that you can think of where it may live in the healthcare environment? Tray table. Nadine says tray table. Brittany said bed rails. Absolutely. Call light cord. Yeah. Bathrooms. Absolutely. Side rails. Great. You guys got it. Yep. So those are some environmental reservoirs that we may find C. diff living or spores of C. diff living. And germs need to be delivered to that person to get around their body's defenses to infect them. So do you care for patients who are currently or have recently been taking antibiotics? They're likely ill with another infection, which may lower their body's defenses and make them more vulnerable to CDI. Those who are already ill or potentially already infected, lowering their defenses. Germs also need to survive in the environment while they spread to be able to cause an infection when they reach someone. C. diff spores can live on surfaces for long periods of time, as we talked about earlier, but infection control actions at any of these points keep the germs from causing infection. So, what are some actions? Now, you all mentioned some environmental reservoirs where C. diff spores may live. What are some actions we can take to reduce the risk of C. diff from spreading? Right? C. diff spores can certainly live on healthcare personnel's hands. And we have Bill saying hand hygiene. Excellent. Perfect. Use of PPE. Definitely. How about the environment? As we think about these environmental reservoirs, what are some actions we can take to prevent C. diff from spreading to another person? There you go. Frequent cleaning and disinfecting. Absolutely. Disinfection, which we'll get into a little bit more detail later on. Perfect. Thanks so much for sharing. Appreciate the participation. Excellent. So, as I mentioned, C. diff lives in the gut, in the GI tract, and it is shed in feces. C. diff spores can be transferred to patients via the hands of healthcare personnel who have touched a contaminated surface or item. Any high-touch surface or device that becomes contaminated with feces could serve as a reservoir for C. diff spores. C. diff spores can be transferred to patients via these contaminated surfaces by the pathway touch, either directly or indirectly. The hands of healthcare workers, devices such as blood pressure cuffs, commodes, which you all mentioned, bathtubs, handrails, bedside tables, any surface, device, or material, linens, commodes, shared equipment, thermometers, blood pressure cuffs, the remote controls, anything like that that becomes contaminated with feces could serve as a reservoir for these C. diff spores. And there are some places where germs can be found in the environment. So we've reviewed our reservoirs and pathways and identified some infection control actions. Let's go over this scenario that we might find in a healthcare setting. So here we have a healthcare worker and a patient. The worker could touch the bed rail in the patient's room without cleaning their hands first. C. diff spores may be on the bed rail and then transfer through touch to the healthcare worker's hands. So how is that going to get to someone and infect them with C. diff? The worker's hands are contaminated. Before touching the bed rail, the patient could pick up the germ on their hand when they touch the bed rail if it hasn't been cleaned and disinfected first. The patient could then pick up food with hands and eat it, delivering the germ to their body. The germ has survived because the bed rail wasn't cleaned and disinfected, and the patient's natural defenses can't fight it off. The patient is now infected. Now, the way that I just outlined the 5 elements in this example isn't the only way germ spread could happen. In fact, there are many ways that the elements could work in this scenario for an end result of the patient becoming infected. It's also important to remember that the elements are that germs need in order to make someone sick aren't steps in an order, and that it's not inevitable that someone will get sick from a germ. Infection control actions can keep germs from spreading at any point: reservoir, pathway, new person to infect, their body's defenses, and survival of the germ itself. So now we'll get into our infection control actions, talk about infection prevention and control. So as we know, standard precautions are used for all patient care based on risk assessment and make use of common sense practices and personal protective equipment use that protect healthcare workers from infection and prevent spread from patient to patient. So I highlighted some bullet points here that especially apply to the care of the patient with CDI. Hand hygiene before and after glove use is recommended in the care of the patient with CDI. Use of personal protective equipment, PPE, gloves, masks, and eyewear. Wear gloves whenever there is a potential for contact with diarrhea. Do not wear the same pair of gloves for the care of more than one patient. And wear mouth, nose, and eye protection during procedures that are likely to generate splashes or sprays of body fluids. Cleaning and disinfecting environmental surfaces, like we all mentioned, cell phones, monitors, door handles, stretchers, bed rails. Utilize disposable equipment if possible. Disinfect immediately after use with the correct disinfectant for the particular bacteria or virus that we're dealing with. Laundry handling. When you dispose of soiled linens, place them in the proper receptacle. Carry these items away from your clothing. Strip and handle bed linens in a manner which avoids shaking and suspending spores in the air. And also proper waste management. Waste that is produced from a procedure must be disposed of properly. You want to make sure that any waste that's saturated with blood or body fluid end up in the medical waste bags and not in traditional trash as per your facility policy. So standard precautions are frequently where healthcare workers can get complacent. We are very busy, so the extra few minutes to perform hand hygiene thoroughly or donning the appropriate PPE can seem time consuming, but these are small things that can make large differences. As healthcare personnel, we have an obligation to our patients, coworkers, and our families to maintain standard precautions for infection control while caring for our patients to help keep everyone safe. So some specific guidelines for preventing the spread of C. diff and CDI in healthcare. There are several measures, including performing hand hygiene, that should be applied to prevent and control C. diff infection. The following is a brief description of these key steps, which should be in place when CDI is present. Patients should be placed in isolation when infectious diarrhea is present, and at least for the duration of their illness. Hand hygiene, unless hands are visibly soiled, alcohol-based hand sanitizer is preferred over soap and water in most clinical situations because it is more effective at killing germs on hands than soap, is easier to use when providing care, especially when moving from soiled to clean activities on the same patient or in moving between the care of a patient in shared rooms. It results in improved skin condition with less irritation and dryness. Improves hand hygiene adherence. And you always want to wash with soap and water when hands are visibly soiled, before eating, after using the restroom, and during the care of patients with suspected or confirmed infection during outbreaks of CDI and other highly infectious GI illness with potentially infectious diarrhea such as norovirus. Contact precautions should be initiated once infectious diarrhea is suspected. Healthcare workers should wear gloves and gowns when providing care for patients with C. diff and should discard them immediately after they have been worn for patient care activity. There is evidence that wearing gloves significantly reduces CDI and is therefore crucial, but even with correct glove usage, gloves are not a substitute for hand hygiene. And patients with CDI should have their surroundings and other areas of concern, such as toilet areas, cleaned at least daily using clean equipment and an EPA-verified product. Remember to be aware of what products are being used in your facility and their contact times recommended for killing spores formed from C. diff contamination. Only hospital surface disinfectants listed on EPA's List K are registered as effective against C. diff spores, which I'll show you a little bit later. Also, careful handling of contaminated clothing is essential to prevent the spread of any of the bacteria or its spores to hands or other items. So we'll go into these a little bit more detail. So healthcare workers have been identified as a reservoir for C. diff. That is why hand hygiene is so important when caring for patients in healthcare. Hand hygiene should be performed before and after patient care activities. Like we identified earlier, C. diff is a spore-forming bacteria, and spores can live on healthcare workers' hands and patients' hands for long periods of time. Hand hygiene is vital when caring for patients with known C. diff. Alcohol-based hand sanitizer or soap does not kill the spores. The friction of performing hand hygiene using soap and water for hand washing washes away the spores, therefore reducing the risk of spreading CDI to yourself or others, especially during an outbreak in the facility. Proper glove use, including correct donning and doffing, is also key in stopping the spread of CDI. Gloves should always be worn when caring for someone with suspected or known infection. Gloves and gowns, I should say. Hand hygiene is an essential practice for all healthcare workers, physicians, doctors, nurses, practitioners, pharmacists, dentists, and other care providers, including community health workers and family members, in order to protect the patients and themselves. So here I just wanted to show you this quick video from the Clean Hands Count campaign from the CDC.
We all know about the growing threat of antimicrobial resistance and have seen the headlines about superbugs and nightmare bacteria. Unfortunately, this threat is very real, now more than ever. It's critical that we work together to contain these drug-resistant pathogens and the infections they cause. Keeping our hands clean is one of the most important ways to prevent the spread of infections. Every time we enter the patient zone, we can get dangerous germs on our hands and spread them to ourselves or to other patients. Sometimes we don't clean our hands as often as we should, not because we mean to do harm, but because it's a daunting task. Some of us might have to do it 100 times a day. It takes dedication, mindfulness, and time. Our patients' lives depend on it. Let's applaud the efforts and improvements we've already made. Increases in hand hygiene adherence have led to decreases in healthcare-associated infections. At the same time, we know there is still room for improvement. We can all do better. Our clean hands count. Now, more than ever.
And Abby can share the link to that infographic there in the chat, so you can have that for your resources. So just to highlight some key points about hand hygiene. So as we mentioned, C. diff is a spore-forming bacterium. It can lead to healthcare-associated infections causing severe diarrhea. Spores are an inactive form of the germ and have a protective coating, allowing them to live on surfaces for months. The bacteria can be transferred to patients via the hands of healthcare providers who have touched a contaminated surface or item. Excuse me. Unless hands are visibly soiled, alcohol-based hand sanitizer is preferred over soap and water for cleaning hands in most clinical situations. This recommendation does not vary when caring for patients with C. diff infection. Although there is theoretical advantage to cleaning hands with soap and water when caring for patients with CDI, CDC still indicates a preference for alcohol-based hand sanitizer, as studies have not shown a clear prevention benefit for soap and water, and removing alcohol-based hand sanitizer risks reducing hand hygiene compliance overall. So when entering the room of a patient with C. diff, the priority should be to use gloves in addition to a gown and apply proper technique when removing gloves to minimize the risk of self-contamination. Current evidence demonstrates that C. diff spores may not be fully removed from hands, regardless of the method used to clean hands. This further emphasizes the need for appropriate use of gloves for the care of patients with CDI. As an additional precaution during outbreaks of C. diff, CDC encourages hand washing with soap and water after the care of patients with known or suspected infections. This is recommended due to the theoretical increased efficacy of soap and water for removing spores from the hands, although evidence for this recommendation is limited. Again, proper use of gloves in addition to a gown to reduce bioburden on the hands should be emphasized. In summary, alcohol-based hand sanitizer is used to prevent the spread of HAIs because it promotes or increases healthcare worker adherence to hand hygiene compared with soap and water. Just a couple of discussion questions here. So should we remove alcohol-based hand sanitizer from areas where there is CDI? So throw your answers there in the chat, yes or no. Should we remove alcohol-based sanitizer from areas where there is CDI? No, no, no. Very good. No. Excellent. No. Very good. Perfect. So the answer is no. Alcohol-based hand sanitizer is required at the point of care for a number of reasons. They're easy to use and therefore more likely to result in greater compliance with the need for hand hygiene by healthcare workers. They are proven to be effective in killing a range of pathogens and therefore reducing patients' risk of acquiring healthcare-associated infections. They are effective in killing the non-spore form of C. diff, which may be present in higher numbers than the spores. Sinks for hand washing are not always readily available, and even if they were made available right next to a patient, washing takes at least twice as much time than rubbing. All factors that mitigate against full compliance with hand hygiene. Relying on promoting hand washing only in healthcare is thought to result in lower compliance, lower efficacy, and greater risk of continued spread of pathogens. Evidence-based research reinforces the need for presence of alcohol-based hand rubs to ensure maximum patient safety. There is no evidence to suggest that their use has been connected with increased CDI. Very good. Our next discussion question. Does the promotion of alcohol-based sanitizer imply the downgrading of sinks and hand washing with soap and water? So we get some no's. Very good. Again, the answer is no. Guidance usually highlights the fact that hand washing is essential in specific situations. Although washing hands with soap and water remains an accepted method for routine hand antisepsis, alcohol-based hand rubs should be promoted as a gold standard for hand hygiene, considering in particular their dramatic impact on improving compliance with hand hygiene and ensuring clean, safe hands. Very good. Thank you for participating in that discussion. And we'll talk a little bit more about transmission-based precautions. And we have our contact precautions sign there that Abby can share the link in the chat for you. So transmission-based precautions, if a patient has had greater than or equal to 3 stools in 24 hours, we want to isolate immediately and initiate contact precautions, even if you only suspect C. diff infection. Place these patients in private rooms, and if private rooms are not available, they can be placed in rooms with other patients with CDI, which is also known as cohorting. Cohorting should be considered in conjunction with a risk assessment and infection control expertise. And we want to follow evidence-based protocols for removal of isolation precautions. Because patients with CDI continue to shed the organism for several days following the end of diarrhea, some institutions routinely continue isolation and contact precautions for either several days beyond symptom resolution or until discharge, depending on the type of setting and average length of stay. It's important to know and follow your institution's policy, which may have more stringent guidelines. And transmission-based precautions continued. So in addition to standard precautions, we're using contact precautions with patients with known or suspected CDI, which includes use of gowns and gloves before entering the room and during the care of a patient with known or suspected CDI. We want to use dedicated patient care equipment whenever possible. If not possible, we use an EPA List K disinfectant immediately after each use. And we want to make sure that we communicate the precaution status to direct caregivers and other key staff, including environmental services, dietary, physical therapy, and any practitioners that may be involved in the patient's care. And then discontinuation of precautions when diarrhea has resolved. Some experts recommend continuing precautions for 48 hours after the resolution of diarrhea due to continued shedding, environmental contamination, and patient skin colonization. But make sure you follow your facility policy on when to discontinue. And I just wanted to share this clinical practice guideline for testing to confirm C. diff infection in patients. Assess for appropriateness of testing. Consider other infectious or non-infectious causes of diarrhea before testing for CDI. Discontinue laxatives and wait for at least 48 hours before testing if still symptomatic. Once a patient has a positive CDI test, do not repeat testing to detect cure. Tests may remain positive for up to or greater than 6 weeks. And tests should never be ordered for formed stool. So you want to consider use of a standardized criteria for CDI testing excuse me, within your facility. Be familiar with your laboratory requirements. Some labs will reject samples if criteria are not met. For example, the lab may not accept a specimen that is not entirely liquid, or if the patient or resident has used laxatives in the last 24 to 48 hours. So for final poll question, when can a patient with CDI be removed from contact precautions? A, never. The patient should remain on contact precautions indefinitely. I'm sorry about that. B, if the patient is feeling better with only one watery stool a day. C, CDI does not require contact precautions or isolation. Or D, for the duration of illness. I'll give you about 30 seconds here to answer that. All right, great. We had 97% pick D, duration of illness, and that is absolutely correct. Thank you for your participation there with our poll questions. And although your facility policy may differ, according to Appendix A, type and duration of precautions recommended for selected infections and conditions, guidelines for isolation precautions in a healthcare setting for gastroenteritis from CDI, contact and standard precautions should remain for the duration of illness. Refer to your facility policy to see what is required in the criteria for removing patients from isolation. All right, very good. We'll talk a little bit about cleaning and disinfection. Communicate to all staff involved in cleaning and disinfection the isolation status of patients with CDI. Read labels clearly to ensure products are effective against spores, and that will be found on the Environmental Protection Agency List K. Make sure all staff know who is responsible for cleaning and disinfecting in the care of the patient with CDI. Create daily and terminal cleaning protocols and checklists for patient care areas and equipment. Perform daily cleaning of CDI patient rooms using a C. diff sporicidal agent or List K agent. Clean and disinfect the patient care environment, including the immediate vicinity around a CDI patient and high-touch surfaces at least once a day, including toilets. Clean and disinfect all shared equipment prior to use with another patient. and clean additional areas that are contaminated during transient visits by patients with suspected or confirmed CDI, such as radiology areas, emergency departments, physical therapy areas, and make sure that the entire facility is aware that the patient is infected with C. diff and that an EPA List K agent should be used for disinfecting. And we want to clean soiled areas and high-touch areas. Proceed from cleaner to dirtier areas to avoid spreading dirt and microorganisms. Examples include during terminal cleaning, clean low-touch surfaces before high-touch surfaces, and clean patient zones before patient toilets. So this is just an example, what you'll see when you go to the Environmental Protection Agency registration List K to check if your product is effective against spore-forming bacteria. And Abby can share the link in the chat there, so you can be directed to that website and check your products to see if they are effective against C. diff spores. So List K products are registered for use against C. diff spores, and EPA has reviewed required laboratory testing data demonstrating that these products do kill the spores of C. diff. A product's effectiveness can change depending on how you use it, so disinfectants may have different directions for different pathogens. So follow the label directions for C. diff carefully, including the contact time or dry time. And our last infection control action, which I wanted to highlight, is antimicrobial stewardship. So more than 2.8 million antimicrobial resistant infections occur in the United States each year, and more than 35,000 people die as a result. Ensuring appropriate use of antibiotics is one of CDC's core strategies to combat the threat of antimicrobial resistance. Antibiotic stewardship is also important to ensure equitable access to high-quality health care and to optimize treatment of infections and patient safety. So antibiotic use is a major risk factor for CDI. I want to develop facility-specific treatment recommendations for common infections that include first and second line antibiotics, ensure that patients receive the shortest effective duration of antibiotic therapy, and include inpatient antibiotic duration when determining post-discharge antibiotic duration. And here we have another infographic that you can use to raise awareness in your facility, and Abby can post that link there. And why is this so important? As healthcare personnel, we must advocate for the best outcomes for our patients. Gaining knowledge about antimicrobial stewardship can empower us to encourage prescribers to make informed decisions about treatment options, especially for those who are most at risk for CDI. Antibiotics have transformed the practice of medicine, making once lethal infections readily treatable and making other medical advances like cancer chemotherapy and organ transplants possible. Prompt initiation of antibiotics to treat infection reduces morbidity and saves lives. For example, in cases of sepsis. However, about 30% of all antibiotics prescribed in the U.S. acute care hospitals are either unnecessary or suboptimal. And like all medications, antibiotics have serious adverse effects, which occur in roughly 20% of hospitalized patients who receive them. Patients who are unnecessarily exposed to antibiotics are placed at risk for these adverse events with no benefit. The misuse of antibiotics has also contributed to antibiotic resistance, which is also a serious threat to public health. The misuse of antibiotics can adversely impact the health of patients who are not even exposed to them through the spread of resistant organisms and C. diff. So CDI is an urgent public health threat that can be prevented. It is the leading cause of HAIs. Proven practices, when implemented, can reduce the burden on patients and healthcare personnel. With ICP practices like identifying who is at risk, implementing core ICP practices and antimicrobial stewardship, we as healthcare personnel can reduce incidences of CDI. Here we have some resources, and you can visit our website and any of our social media sources here. I want to thank you again for joining us today. We do have We're a little short on time. We have about 1 minute left. I do want to share our upcoming webinars. We have Blood, a quick refresher, which will be presented on November 18th by my colleague Jacob Peguera at 12 p.m. And Preventing C. auris, a refresher session, which will be presented on December 2nd by my colleague Lisa Ledoux at 12 p.m. And Abby will be sharing our link to sign up for those sessions. Here are our references for today's session. And just to highlight, we have the day off tomorrow to go out and vote. So our post-session survey and quiz will be sent to you Wednesday, the 6th. We also have a holiday on the 11th, so our post-session survey will close on the 12th at midnight. So make sure you fill that out in order to receive your certificate of training and your continuing education credit. And the post-session quiz will also be included in that email. So go ahead and fill that out as well to receive your certificate on the 18th. And if you have any questions, like I said, regarding that, please feel free to reach out to us. We have just a quick poll right at the end of the session here for you to fill out. End of session feedback, just 3 questions there. And if anyone has any questions, if you'd like to stay on for a couple of extra minutes, we can accommodate you. All right, so if no one has any questions, I just want to thank you so much for coming out today, joining us. And remember, November is C. diff Awareness Month, so use those resources that we shared in your facilities, share them with your colleagues, and get the word out about C. diff. And then hopefully we'll be doing some activities for Antibiotics Awareness Week as well. So Antibiotic Stewardship Awareness Week. So thank you so much again, and I hope you have a great day and get out there and vote.
Thanks, Steph. Bye, everyone.